Hello, Doc.
Great conversations and education on relevant health issues management. Hello, Doc.
Hello, Doc.
Make a date with our health professionals on the drive with the area gang. Mondays 2:45 to 3 p.m. Hello, Doc. Hello, Doc.
Hello, Doc.
Yes, so it is time for us to get interactive with Dr. Emefa Dzide. It's my first time meeting her, but actually I've been listening to her almost every time, and it's also good to have you. Good afternoon to you, Mom.
Good afternoon.
How you doing?
By God's grace.
So Saturday was International Women's Day, so I'll take the opportunity to wish you a happy, is it a belated International Women's Day? And thank you so much for always teaching us about our health and everything we need to know. Today we're talking epilepsy and seizures. I first want to understand this. Are there differences? Do they differ? What is the difference between epilepsy and then a seizure?
Okay. So you let me start from describing what a seizure is.
Okay.
So usually seizures are the symptom of epilepsy.
Oh.
Yeah. So a seizure is when there is abnormal brain electrical activity. So like there's a surge, electrical surge kind of in the brain.
I'm smiling.
So when that happens, then the person loses awareness usually, and then there's this jerky, uncontrolled muscle movements of the body. Yeah. So a seizure can be provoked or unprovoked. Unprovoked seizures is what we call epilepsy.
Oh.
Yes, so with that, there's no physical or physiological cause
To it.
Yes. It's at the level of the cellular level in the brain. So you do scans and all those things. You won't see any problem physically with the structure of the brain.
Okay.
But the function is what's wrong in epilepsy. But other seizures, provoked seizures, they can be caused by a lot of different things. They can be caused by accidents, head injuries. They can be caused by infections. And especially in little children, 6 years and below, they have what we call febrile seizures. So if the temperature gets too high, above a certain level, then the children tend to have seizures. Yes.
You spoke about electrical. You said electrical what?
Activity, like electrical surge in the brain.
Is there cables in there that are connected to the electricity? Maybe that we should know.
No, it's the way we describe how the impulses of the
brain,
the cells, the neurons communicate with each other.
Okay.
It's like an electrical transmission through the neurons.
So that is what sometimes disconnects, and then
it gets like sometimes overload, just a bit messed up, and then. Yeah.
Oh, okay. Now let's talk about the warning signs. What will you see before you know that this thing that I'm experiencing is a warning sign to either seizure or epilepsy?
Okay. So generally with the provoked seizures, you would have something before. It's probably if you're a diabetic, your sugar is too high or too low. That can also lead to a seizure. Okay. So usually with the provoked seizures, there's usually something provoking it. Okay. Poisonous bites of snakes or something, or you are just feeling very ill. But with epilepsy, there isn't really an identifiable cause, but like physically, but they usually have what we call an aura. So they have, sometimes it's like headache, sometimes it's dizziness, sometimes they see some distortions of light, sometimes their senses are altered, like they hear things differently, feel things differently, taste things differently. So that tells them that something is
happening.
Yes, something is happening, or a seizure is about to come. Sometimes strong emotional changes can occur to show you that probably something is about to happen. Sometimes the person will be sweating a lot, and excessive saliva and those kind of things. So there are some kind of things that will prompt the person with epilepsy to know that some a seizure is about to. Okay.
Oh, okay. So if I am epileptic and then maybe unconsciously, or maybe I'm just walking about, nothing is wrong, but then all of a sudden I wake up and then I'm all messed up.
Yeah.
No signs.
Yeah, sometimes it happens like that as well.
Wow. Okay, I'm learning a lot today. Now let's talk about are there medical conditions that contribute to epilepsy or even the seizures?
Yes. So there are a number of medical conditions. There are let me talk about the medical conditions that most commonly cause seizures.
Seizures.
Yes. So most commonly we have bleeding into the brain.
Oh.
Yes. So especially if there is a stroke, there's bleeding into the brain. That's is one of the most common. Yes.
Okay.
So we call those aneurysms.
Oh.
Yes. Then there's brain tumors, which can also cause the how do you call it? The seizures. Then we have stroke. I mentioned diabetes if the sugar is not well controlled.
Yeah.
Yes. Sometimes we have these degenerative diseases like dementia, Alzheimer's disease. They're also prone to having. Then we have a condition called eclampsia in pregnancy.
Yeah.
Yeah. So when their blood pressure is high and then there is altered kidney function, you see proteins in the urine. That also can lead to seizures, which is the eclampsia.
Okay.
Yeah. And then sometimes the electrolyte imbalances. So sometimes there's too much sodium in the blood, too much magnesium. That can also lead to seizures.
Seizures.
Yes. Then there are also common conditions that can cause seizures, but they are not. The seizures in those conditions are not that common. If you understand what I mean. Yes. So usually infections, especially in the brain, encephalitis, meningitis. Those are the most common cause. But sometimes generalized sepsis can also cause seizures. Sometimes autoimmune diseases. Those who have SLE and those group of diseases, sarcoidosis, those kind of things, they can also have seizures. Sometimes mental illness issues can also cause seizures or something similar to seizures. Yeah. Then also congenital abnormalities. That's when they are born with a defect in the brain.
Sure.
Yes. And then I mentioned venomous bites and stings, as well as toxins and poisons. Yeah.
All these things can cause.
Yeah.
Now, when you mentioned seizures when it comes to dementia and all those things, it took me back to some time. I had a friend or somebody very close. There wasn't a sign of either dementia or whatever it is, but then the person took alcohol, like he is a chain alcohol drinker, if that is the right word to use. And then at one point, he went to work and then he had a seizure. He started biting his tongue and all those things. What might have caused that? Was it the alcohol, or was it something that we should have known that, okay, this, but then at the end, he suffered dementia?
Okay, yes. So he probably had brain injury from the seizure. Okay, yes. And usually people who are alcoholics tend to be prone to having seizures. Sometimes if there is alcohol poisoning, too much alcohol, they can have seizures. And sometimes too, if there's alcohol withdrawal, that means the body has gotten used to the alcohol. So once he stopped the alcohol for, let's say, 24 hours with no alcohol, then the body reacts that way.
Wow.
And then they go into seizures. Yeah.
Can someone with broken heart also have seizures?
Well, not directly, not that I know.
Okay, all right. That was just something to throw in. But then, are there treatments to these seizures and then epilepsy?
Yes. So with the provoked seizures, of course, you treat according to what is provoking the seizure.
Okay.
Yes. So if it is diabetes, you have to manage it well and all that. If it is a child having the febrile seizure, you have to now investigate what infection does the child have. Usually it's malaria in our area, but it could be even a tonsillitis or something. Once the fever is so high, yes, then the child would get. So you have to investigate what is causing the fever.
The fever.
Yeah. But with the epilepsy cases, that one you have to actually do a lot of investigations to rule out other causes, other physical causes, if maybe there's a brain deformity or a tumor or something causing it. But if you rule that out and then you are confirmed to have epilepsy, there are medications, anti-epileptic medications that you are supposed to be taking on a regular daily basis.
Okay.
Yeah, so that's it.
That's it. Now, let's talk about this. When I was young, I used to observe this particular child who had, let me put it, seizures. And then everybody will start running helter-skelter, and then they will go and pour water on the touch, and they'll put the baby beneath it for the water to pour on the baby so many times till the baby regains consciousness. And sometimes they'll be forcing spoon into the mouth of the baby and all that. Now, if somebody is suffering seizure or epilepsy, what are some of specific safety precautions that we should look at?
Okay, so once someone is having a seizure in front of you, the first and most important thing is don't panic. Don't panic. Don't start, because once you panic, you are not thinking straight. Okay, so you don't panic. Stay calm. Take note of the time that the seizure has started. Okay. You remove things around the patient that might injure them. So if maybe it started in the kitchen, right? So you have to just remove any, maybe there's a knife or anything.
Even fire.
Yes, you have to just keep the person safe within the area. Don't try to move the patient immediately. Just monitor, make sure the environment is safe, and then once it stops, you just have to be by their side, okay, and just reassure them until they recover. Usually they are confused and a lot of
things.
Yes, so you have to just reassure them once they recover. So you don't really have to do anything. Usually putting the spoon and all those things rather cause injury to the person, because they are not able to control like
what they do.
Yes.
But I'm told they are biting their tongue and all those, so you need to avoid that.
Yes. So you can have something a bit softer to put in there, but the spoon can break their teeth and all that. Yes. But you also have to take note that you don't want to block the person's breathing, the person's airway. Yeah.
Okay.
Yeah, but usually there's seizures last for just like some seconds to a few minutes.
Yeah.
So if the person's seizure is lasting up to 5 minutes, then you know that then the person is going to a stage of brain tissue damage.
Oh.
Yes. So you have to move the patient as quickly as possible to the hospital. But most often, the seizure just lasts a few seconds, 30 seconds at most, 1 minute usually. But if you see the seizure is becoming too long, then you have to rush the person to the hospital. Or if the seizures are short, but they keep having back-to-back seizures without waking up in between the seizures. Yes, that one too can also lead to brain damage. So you have to rush the person to the hospital.
Wow. Let me ask this. Most times, traditional mothers, when a child starts having a temperature, then they will say, oh, smear Nkuto on the child, and they will be smearing Nkuto and all that. Does that one also work? They said it to avoid seizures.
No, that does not. I don't know if that lowers body temperature. Though. I'm not sure about that.
Okay.
But the problem is that the body temperature is too high for the brain.
Okay.
Yes. So you just have to avoid the child's fever getting too
high.
Yeah.
Now, how can we then track and then manage epilepsy and seizures?
Okay. So as I said, you have to manage the underlying conditions. If you have a chronic condition, diabetes, if you have a stroke, those you have to manage them, take your medications and all that. For the epileptics, you have to just stick with your medications. Always at least have an alarm, especially the parents of the epileptic children. Make sure you have something to prompt you to remember to give the child the medication. They've also mentioned low carbohydrates or ketogenic diets could also help reduce the seizures in epilepsy cases. Okay. So you could also do that to try and manage the epilepsy. But please do it in conjunction with your doctor. Yes.
Now, to wrap up, we're coming to our family members. How do our family members and friends get to know more about epilepsy and also the seizures? And if myself, I have epilepsy or seizure, what do I need to know?
Okay. So let me talk about children first.
Okay.
So especially those who are going to school and all that, the parents should please always inform the school authorities, especially the teacher of his or
child.
her class. Yes. Inform them so that they can monitor the child and then make sure the child doesn't enter into certain triggering or dangerous situations. Yes. Aside that, they also have to have a plan for if the child has a seizure in school, what the teacher should do. You have to be able to be clear and then instruct them well. Otherwise, they'll end up leaving the child to get an injury or something.
Yeah.
Yes. An important thing is there are some social effects and psychological effects of someone having epilepsy.
Okay.
Yes, so they are at risk of having a low self-esteem because they can't predict when the seizures will come. They can be very anxious. They can have very serious anxiety problems.
Sure.
That might also lead to depression if they are not careful. Yes, so you have to be very watchful of your relatives and friends who have epilepsy. And children too may, not usually, but sometimes they may have some learning difficulties, issues with their memory when they have epilepsy. And sometimes the epileptic drugs can also make them drowsy and they can't concentrate very well and all that. Yeah, so just in all that, you should just let the epileptic patients avoid so much social isolation. Yes. And sometimes the parents can be overprotective.
I know,
because
right?
of that. The child cannot even go and play with their friends. You have to try and manage it. Just make sure you monitor the child. Not that the child should be in the house the whole day and then you don't let them go out because you are scared.
Sure.
That can also negatively affect the person.
child.
Yeah.
We would say thank you. It's been a great discussion. Myself, I've learned a thing or two because growing up, I kept certain things in mind because of some of the things I've seen. But then today, you've made it very clear to me. And then tomorrow, when I see something like that, I know what to do. Thank you so much, Dr. Emefa.
Thank you too.
All right. So that was Hello Doc for you. And I hope you've been thoroughly educated. When